In West Africa, drug addicts have become accustomed to smoking the remains of the dead, reports The Telegraph. There, they came up with a new drug from chemicals mixed with crushed bones of corpses. As a result, in Sierra Leone, they pay good money for a kilo of human bones on the black market, and local cemeteries are worth excavating. This new synthetic cannabinoid drug is called Kush, and it is as dangerous as heroin and cocaine. More precisely, semi-synthetic, since Kush is a mixture of opioids, cannabis, disinfectants, formaldehyde, for example, and crushed human bones dug out of graves. The devil's mix is wrapped in paper and smoked to completely disappear from reality. From Sierra Leone, the fashion for jackpot spread to neighboring countries, Liberia, Guinea. The Telegraph calls it a real zombie epidemic. After all, people who use Kush smoke the dead and become like the living dead themselves. With their heads tilted unnaturally to one side, they continually walk in circles with glassy eyes. Some never come out of this state. They bang their heads against the wall to death or walk fearlessly from a height, and they themselves become corpses, which perhaps will be smoked by new zombie drug addicts. Unemployment in Sierra Leone reaches 60%, and you can get good money on the black market for a kilo of bones. That's why they dig up graves there. According to local residents, more than 2,000 graves have already been looted, which is why the authorities had to organize armed squads to guard the cemeteries. The government considers the situation in the country to be an emergency. The police are arresting dealers but are encountering fierce resistance. The drug cartels are well armed, the newspaper writes. The appalling poverty of West Africa, the complete lack of hope among local youth for even the slightest improvement in living conditions. These are the reasons for people turning into zombies, and there is no one to treat them for drug addiction. According to the World Health Organization, there are only 5 psychiatrists in all of Sierra Leone, a country of about 8.4 million people. In fairness, it should be noted that at one time there was a demand for human bones and carrion in Europe. Since the Middle Ages, European doctors have offered their patients the bones of the dead and Egyptian mummies ground into powder to cure a number of ailments which were considered extremely effective therapeutic agents. This medical cannibalism lasted until the beginning of the 18th century.